Okay, this is the angle that y'all are getting because both of my cats are asleep on me right now, so I'm not moving. Um, this is the structured reflection for the knee, the first one. Um, so history, a 17-year-old soccer athlete was hoping they would say male or female, but they never did. Doesn't matter too much. That would just tell me injury prevalence data, basically. Not necessarily, but or not necessary, but would just give me more information. No significant past medical history, so probably not chronic. Presented with acute right knee pain. That tells me that it was probably something traumatic. Since it was acute, again, without the medical history. And then playing soccer, I kind of listed here that a traumatic force in soccer is probably most likely somebody hitting them planting and twisting to turn, them getting stuck in the ground, or something with them jumping. It occurred following a various stress contact injury, so that's the hit. Varus, as I wrote up here, was medial to lateral force or medial to lateral stress on the knee. So most likely we're looking at um I guess I'll get to that later. Varus stress contract injury during the game. Contact occurred with the opponent while initiating a jump in the air. So a concentric movement, the knee was flexed. Originally, I wrote over here that they probably weren't in the air yet because that was the first thing in my brain that I imagined was that if they were initiating the jump, they're probably getting into that squat position before they explode up. So they're still on the ground with their knee bent. So if they were hit, their foot could have stuck, or the flexed portion of the knee kind of changes what or adds a few different options into kind of what could go wrong or what could be wrong structurally. Um, Felt a pop at the time of injury, so something probably muscular, meniscal, ligament, tendon kind of options are still open right now. And unable to bear full weight immediately following the injury, walked with a limp. Not sure yet if that's because of pain or a structural issue. High pain level, which could have been the cause of the non-weight bearing issue. Um, Pain constantly woke him up from sleep, so a male, and was exacerbated with any exertion or ambulation. So again, that hasn't really narrowed anything down from a standpoint of muscular, ligamentous, cartilage, anything like that. Physical exam findings. The right knee exam was significant for moderate effusion, which tells me it was significant trauma and probably something more intracapsular or bone rather than something on the outside. Again, as a possibility, obviously, there's always a chance for increased effusion just depending on the person and the amount of trauma. Significant pain upon palpation along the lateral joint line. So that kind of, I'm over here thinking LCL, meniscus, IT band, hamstring, ACL, if you're kind of getting a little more posterior joint line. Um, Off rip in my brain, when I think joint line, I'm thinking front of the knee feeling around to the side rather than the back so much. But technically, that is still a joint line in the back. You can still feel it. It's just without having the patient sitting in front of me. My assumption is that when they say joint line, that's telling me front to the side of the knee, not the back. Otherwise, it would have said posterior. Full extension was present with flexion to 135. Technically, flexion to 135 could be normal for some people, but the fact that they said it explicitly when they said full extension in my brain, now I'm thinking that this isn't full for this person in particular. 4 out of 5 strength, again, not sure yet if it's pain versus structure. 4 out of 5 strength was noted with flexion and extension of the right knee. No laxity with Lockman test tells me negative for ACL, most likely. Posterior drawer testing with lower extremity external rotated showed laxity compared to the contralateral sides. That tells me positive PCL. Laxity and pain were noted with varus valgus testing at 0 and 30 degrees, which tells me positive for LCL and MCL. That could be strain, that could be um um like a contusion on the MCL side just from being hit. Either one of those, both of those maybe, who knows. Significant pain with Thessaly's and McMurray's testing, both of which are positive for meniscus, along with the lateral and posterior aspect of his right knee. So obviously telling you that that portion of the meniscus is injured.